While the standard tests that are done to assess iron that are done by many physicians include a standard anemia check or a hemoglobin level, and they may look at the size of the red cells themselves, what are called the MCV, anemia is the last end of iron deficiency. Iron deficiency can take place and there may not be anemia yet. So red blood cells live for 90 to 120 days. So just because there's enough hemoglobin around on this day does not mean that there's enough iron going forward. And especially in a pregnant situation where a mommy is now making blood not just for herself but also for her developing fetus, she has an increased need for iron. And if she is just checked to be anemic, it may not be enough for the baby going forward. So the best test that we use is called a ferritin level. And ferritin is the protein that stores iron. And the body inherently knows that when there's not enough iron, that it drops the ferritin level. And when there's enough iron, the ferritin level goes up. Although one caveat is that a ferritin level can be elevated also due to inflammation. But a low ferritin level usually does imply iron deficiency, but again, that can happen even if there's not anemia. So we look typically, and especially in the pregnant state, we try to get the ferritin level above 40, where 50 is kind of the nice range, but we do treat anybody who has levels under 30. Now, we typically find that, especially during pregnancy, where constipation can be a problem anyway, that there's several different approaches that we use for iron. Of course, we'd rather increase iron-rich foods, but some people, especially if they're vegetarians, that may be difficult for them to do. One thing that we will have them do is cook food in a cast iron skillet, which can absorb some of the iron into the food. But if those are not successful or not practical, we then will use iron supplements. And the iron supplement that we find is most helpful is a form called iron bisglycinate, also called Ferritin. And Ferritin is both very absorbable as well as seems to be the easiest on the tummy, least causing of constipation. Now, it's also important that we give vitamin C whenever we give iron, because vitamin C will enhance the iron absorption, so we can get more iron in when we take vitamin C.